morning, students. My name is Mrs. James Obedin. I am here with student nurse Melissa. The procedure we're about to conduct today is bed making, and it's the two nursing procedures. That's why I asked student nurse Melissa to assist me. We have two types of bed making. We have the unoccupied and occupied bed making. And today, I'm going to be showing you how to conduct or to perform unoccupied bed making. Unoccupied bed making can also be called admission bed. So now, here with me, I have my trolley, because the trolley procedure, I have my trolley with my equipment. On the top shelf, I have the bottom sheet, the drawer Macintosh, the counter pen, the top sheet, and my drawer sheet. And below, I have my pillow. This is where the pillow is meant to stay. And over at the bedside, at the end of the bed, we have two chairs. This helps us to keep our linen before using it. It's also used when necessary. So we are going to start right now. The first I'm going to start doing now is we are going to stand in a proper way that will help us assess our equipment and don't move all over the place. Because when making a bed, you don't move around. When standing at the middle, you can assess both the top to the bottom. So now, are you ready for me? I'm going to get my top sheet, put it on the bed. Now we are unwrapping it. This is how you unwrap your top sheets. When making beds, you start from the top to the bottom. You don't start from the bottom to the top. And avoid your linen from touching the floor because the floor might be contaminated. You wouldn't want to contaminate your linen. Hold it this way. You have to measure it so that it will be of equal proportion. This is how we hold it. We raise the bed up, we put it down, at the end of each bed, at the end, we are going to make an envelope corner. What's the purpose of your envelope corner? The purpose of your envelope corner is for beautification and to make it fair. So I've made my envelope corner. Now I'm going to tuck it the remaining. Make it smooth. Making it smooth. Yes. Now we'll go over to the bottom. The procedure you took at the top is do the same at the bottom by making your envelope corner. And as I said before, envelope corner makes the bed firm and is for what? Beautification. Put it this way. And you tucking it what? Properly. You make sure that the bed is on a smooth surface. You make sure the bed is smooth to avoid anything. Okay? So these are bottom shape. The next you carry is your Macintosh. The reason for this Macintosh is to avoid soilage of the bed. You make sure it's smooth because the patient you are bringing might be on the bed for a long time and you wouldn't want the patient to have pressure sore. So all your bottom sheets and your Macintosh must be smooth and placed properly. And you can have excess here. What you do is you ask your partner, are you having excess there? No. You can tuck in it in now. She's going to tuck in her side. While over here I'm having excess, what I will do is I'll fold it this way, tucking this first, and bring it down. Make sure it's always smooth. Then I'll carry my drawer marking touch because the patient cannot lie on a bare marking touch. It will be very uncomfortable for the patient. So I have to place a drawer marking touch on it. While making this make sure your linen does not touch the floor. I'm having excess here too. So you tell your partner to tuck in that side. And the excess, I'm going to fold it this way, tucking the edge before bringing it down. It's smooth. Then the next we are going to conduct now is fixing of the pillow. I'm going to carry my pillow. I'll give it to my partner. This is my pillow case. I'll hold it like this. I'll hold it from the two edge, then I'll hold the pillow. While my partner will be the one to draw the pillow case down. It's covered by and you put it this way. Remember, when putting your pillow on your bed, do not put the open side close to the door. Make sure the open side is away from the door, because visitor might be coming in and you don't want to see allow them to see the rough patches. Now we're going to fix our top sheet. This is my top sheet. This way. Remember when putting the bottom sheet, the rough part was down while the neater part was up. You do same here. When you are putting your top sheet, the neater part will be down while the rough part will be up. Why? Because the patient needs to be comfortable. You can't put the rough part on the patient's body. So you can see right now the rough part is down. We exchange it to make sure that the smoother part is down while the rough part is down. We're going to start from the top. Just to cover the pillow. Then now we go to the bottom. We are still going to make our envelope corner. Let's check if it's inside. Yes. Show us envelope. Show her envelope. And start talking it in. It's good to me. Why you're thinking of touching the floor? Okay. So I get my counter pen. What's the counter pen for? Can you tell me what the counter pen is for?
It's used to beautify the bed.
Yes, the counterpane is used for beautification of the bed. So when the patient comes, the patient will be more comfortable. So now we're going to do the same envelope corner at the edge of the bed. We need to make our envelope corner. We are going to fold because it's an unoccupied bed and we are expecting a patient, so we have to create an entrance for the patient. But when the patient is not coming forth, like when you are not admitting any patient, you can as well leave it this way. But when the patient is coming, we want to create an entrance. Can we do that now? No. It's one after the other. We get our counter there. You fold it. Okay. Then we get our top sheet. Please avoid your linen from touching the floor. Then you tuck in your, make it smooth, you make it smooth, make sure it's smooth. Make it smooth. Make it smooth. So this is our unoccupied bed. A student is about to ask a question. Can we do that?
Okay. Previously, I thought when you want to make unoccupied bed, you don't talk in both sides.
You don't talk in both sides because you are expecting a patient. So you have to make the envelope entering here. Just this way. So that it will be easy for the patients to enter. But when you don't have a patient, you can just plug in everything in. Because patient is not coming. But you can't just leave the bed plain. It has to look neat. So it can be left this way. Any more questions? Ask any more questions?
No.
Okay with that. Okay, now I'm going to strip the bed. You don't just carry it. There's a way for stripping our bed. The first we do now is to put our top sheet first back this way. Put our marking touch this way. Our counterpane this way. Then you strip. Wait, you don't strip one after the other. You strip it like this first. You strip it like this first so that it will be easy for you to remove. When you strip it like this, you take it up. Please, when you are walking, walk with your partner. This way. Very smooth, so that you can use it when you want to use it. Then we do the same for our top sheet. You're losing the edge first. Make sure it's not touching the floor. Losing the edge first. Okay. Fold it to 2, you fold it into 3, then you come together, fold it. So we are stripping the bed now, especially during OSCE when you are done making your bed. For it to be easy for the next person coming to use, you have to strip it neatly. Okay, fold it once, please. Put it on. Put it down here. We do the same for our Macintosh. Hold it. Once you fold everything this way, it will be easy for the next student to perform the procedure. Now I want to strip our pillow. So open it that way. And you hold the edge. The edge. Just hold it. So the pillow, you put it back at the bottom sheet. Now I want to strip our bottom sheet. Move the edges first. Please, when removing the edges, avoid it from touching the floor. Okay, so this is the first folding. You fold the second time. You fold the third time. Then we bring it together. You can see it back at its position, and this way it will be easy for the next patient. To be easy for the next student to perform their bed making. Thank you.